I will now open the floor to questions to Mr. Pantalone. We have someone at the microphone right now. If you'd like to ask your question, please.
Thank you. My name's David Berson, School of Disability Studies. And as Joe Pantalone knows, I have been diagnosed with a serious mental illness. People like me have an 80% unemployment rate. I'm wondering if Mr. Pantalone thinks that City Council has a role in trying to reduce that employment rate, and if so, what role should Council be taking?
First of all, hi David. Actually, David and I were members of Toronto City Council together, and he's done an incredible amount of work in furthering the interest of the mental health community, and he's been a great advisor to CAMH and so forth. You know, the City of Toronto, you should know, of all the taxes that get paid in our community, which is the City of Toronto gets 8%. 92% of all the taxes, and that's how government get our revenues, go to the federal and provincial government. 92% to the federal and provincial government. Having said that, I believe that the mayor of the City of Toronto and the City of Toronto has to take responsibility for anybody who lives within the City of Toronto or comes to work here for that matter. So therefore, whether we have improved programs to hire people who are of special needs, like I said, the accommodation fund earlier is one example of that, or whether it's a serious advocacy with the provincial and federal government, you know, to make sure the proper funding get done for people in need, the mayor of Toronto has to be there. You know, you cannot simply say it's a federal provincial responsibility, therefore I walk away from it. Even though I think I, as the mayor of Toronto, will have a responsibility also to let people know who's making the money, because you'd be interested to know that the federal government this year is lowering the taxes on banks, financial services, by 1%. That means that the banks this year are going to be paying $2 billion less in taxes in 2010 than they did in 2009. And that will be $2 billion more next year and so forth. So therefore, you know, I as a mayor would have an obligation to talk to you and everybody else, say, we should tell Mr. Harper that that's not acceptable, that people who need those kind of funds, which is our money at the end of the day, is people in terms of employment possibility with people with health issues, and not necessarily the banks who do it quite well, thank you. You know, and that goes for the provincial government as well, which, by the way, is lowering the corporate taxes, even though all jurisdictions around Ontario, like Quebec, like New York, like Manitoba, have lower corporate taxes than we do. So they're making choices, which is not to give money for people in need, rather than want to put it somewhere else. And I think that that's wrong. You know, no one should be left behind, and people in need should come up first.
So about 5 years ago, there was a bill passed that all new buildings being built in Toronto had to be made accessible. Since then, I've seen several new buildings being made that clearly aren't accessible. What would you do to enforce this bill?
Well, the law is clear. If it's a new building, you have to be accessible. If somebody is not doing it, I will invite you to send me an email or something. You know, give me the addresses, and we'll have that checked. Because that should not have happened. New buildings need to be accessible. There's some question as to the level of accessibility. I had a gentleman at the Variety Village a few days ago telling me that the bathrooms in these supposedly accessible buildings really did not allow him to maneuver. And I asked him to send me the material, because I will pursue that, you know, in terms of our own building department, and maybe recommend changes to the building code if that's required. So I said, give me the address. The problem is with the older buildings. There's no law that says older buildings have to be retrofitted. There's programs that the governments can do to give them money to do it, but if they do major renovations, then the new building code comes in effect and they have to be accessible. Okay? But if you give me those addresses, I'll be pleased to pursue them for you. Thank you.
Okay, there's a woman who's been waiting very patiently in the middle of the floor.
I thank you for this opportunity to speak about an issue very dear to my heart. Those of us living in environmental sensitivities, specifically multiple chemical sensitivities and electrical hypersensitivities, I'd like to hear from each candidate what you're going to do to accommodate and prevent a serious disability.
Well, the city of Toronto just adopted a right to know bylaw when it comes to chemicals, because we want all companies to tell us what chemicals they are in their place of work, and which will include presumed construction materials and so forth. I'd be interested in finding out more about that and your suggestions, frankly, on what we could do, because like I said before, I'm not an expert on everything. No human being is capable of doing that, so I'd like to learn more and see what we could do based on what is possible. Because I know, for example, some people come up to me and say, you know, I'm allergic to pollen in trees, so therefore cut the trees. You know, well, okay, I might solve that problem. Then we'll have the problem we have no oxygen in the city. You know, we have air pollution, which will do more harm than good. So therefore, you should say, well, there's a greater good here for the greater amount of people, so we cannot cut the tree in front of your house or next door because, unfortunately, you're allergic to pollen. So certain issues are in contradictions with greater societal objective, which all of us want. So I need to know exactly, you know, what you think could be done in order to be able to respond.
May I ask that you requisition the MK files for electrical hypersensitivity research, which have been hidden from us by Health Canada for the last 40 years, and end the radiation of citizens by the city's one zone, and Toronto Hydro's smart meters.
Well, the federal one, I'm running for Prime Minister, as you probably noticed, so I have no authority of the federal government. If they don't give it to you, they don't have to give it to me. The issue of cell phones and radiation, how many people have your Blackberries or portable phones? Put your hand up if you have some of these. You know, so therefore, that may not be as easy, because obviously, unless you would suggest we ban cell phones and Blackberries, I don't know how you can deal with that. That's a bigger issue that requires a bigger conversation, but I don't mean to dismiss your concern, because whenever there's any health issues, they need to be fully explored and see whether there's ways of putting pressure perhaps on the manufacturers in order to make sure they have a safer product while providing the service which all of us are claiming for.
The problem is with Health Canada Safety Code 6.
I'm sorry, I'm going to have to interrupt. There are other people asking. The woman in the purple who's been waiting very patiently. Thank you for your patience.
I wanted to know, I'm a little bit speaking to breast cancer. I'm not able to work at the moment because I'm still chemo. There were rumors that a special diet would be, amount would be cut. If that is happening, I cannot stay healthy. And obviously it's not even enough for me to live on because over 1/3 of my rent is taken up and I cannot get a subsidy. So I am from a working person because I got cancer in abject poverty. And I would like to know what we can do, like can that be subsidy for my rent so that I at least have something to live on? Or should I just disappear and maybe my cancer comes back and I'll die and that solves the problem?
Okay, Mr. Pantalone, how do we break down the difference between the municipal and provincial jurisdictions when it comes to social welfare and providing supports?
Well, whatever powers the city has or doesn't have are given to us or not given by the province of Ontario. And social assistance is a provincial jurisdiction. They set the policies and the city administer them because they recognize the city does a better job of administering it. And by the way, our so-called welfare offices, we call now Toronto Employment Services because we see them as having possibilities to encourage people to do what they want to do, if they want and can, successfully seek employment. I personally would oppose any cut in such in this allocation, and I will argue against it. But I think it's ultimately the provincial government that is responsible for that. But I would advocate against any of its cut, and if there's anything we can do, we sometimes do. For example, the City of Toronto provides a breakfast program for needy children across Toronto. You know, I have said that I want to increase that by an additional 40,000, because if you're a kid and you go to school, if you're on an empty stomach because your family is not able to feed you, well, guess what? You're not going to be healthy, and you're not going to learn as much as you could. And that's social capital, as the professor said earlier, which we'll be missing out as a society as well as individuals. So therefore, to me, cutting that allowance really is inhuman and should not occur. And as a mayor of Toronto, I would oppose it.